Dengue and coronavirus and flu and pig influenza. Dengue, coronavirus, flu, pig influenza, and then some. Specialists shuffle judgments as patients manifest comparative side effects. Specialists fault self-medicine as one reason patients show up in emergency clinic in difficult condition. It additionally brings about more spread and loss of important time for right analysis and suitable treatment, they say. Specialists fault self-prescription as one reason patients show up in clinic in difficult condition. It additionally brings about more spread and loss of significant time for right analysis and proper treatment, they say. Fever. Serious body hurt, cerebral pain, and discomfort may not be the main side effects of general viral fever. Similarly, as with the coming of the stormy season, numerous other tropical diseases start to influence individuals. Specialists across urban communities in India are seeing an expansion in instances of ailments in the short-term divisions that hurl comparable side effects yet are various sicknesses. While some are connected with mosquitoes and sandflies like dengue, intestinal sickness, and chikungunya, others are viral diseases including flu A, flu C, and pig influenza. Aside from these diseases, irregular spikes are seen in coronavirus cases at normal spans. Beginning June, we started seeing the new beginning of intense febrile sicknesses, fever, joined by upper respiratory lot side effects, for example, hack, throat agony or bothering or runny nose, that would generally keep going for a few days, Dr. Animesh Arya, Unit Head, Respiratory Medication, at Delhi-based Cerebrology Activity Clinical Foundation, told News18.com. When it enters the family, it is probably going to contaminate everybody, except for a brief period. While most of individuals experiencing the episode of occasional fever, which is informally known as viral fever, will get well soon all alone, specialists have begun testing for event of gentle flu A, serious flu C, and pig influenza, H1N1, for the people who don't improve or show marginally various side effects. Arya said. Presently, coronavirus upsides have gone down, though dengue analysis has gone up alongside flu. Specialists, in different states, saw a comparative pattern. While it is troublesome ordinarily to separate between the side effects, a few highlights may be useful, Dr. Sakshi Manchanda, expert for inner medication at Medanta in Lucknow, said. For example, patients experiencing dengue will have serious body throbs separated from fever as side effects. A high file of doubt is required, and ordinarily tests for both pig influenza and coronavirus are requested as the two of them can prompt serious infection. Dengue ought to be tried particularly in the event that platelets are low, she said. As per Dr. Sudha Menon, Chief, Inward Medication, at Fortis, Bengaluru, a larger part of the respiratory lot diseases are beginning in kids and in this way spreading to grown-ups. We are seeing a huge number of viral diseases throughout the course of recent weeks. Coronavirus, flu A, and pig influenza are normal airborne diseases, while dengue and chikungunya are mosquito-borne. Tragically, the underlying side effects of fever, migraine, serious body hurt, and discomfort are normal in all popular contaminations. Self-prescription prompting serious ailment. Clinical specialists propose that it is vital to take proficient guidance for any such side effects as opposed to postponing treatment or self-recommending medications. Assess patients completely. It will provide a guidance. For example, if retroorbital torment and serious spinal pain are there, we suspect dengue. Assuming hack is there, we do coronavirus testing, and in the event that coronavirus is negative, we send for H1N1 or pig influenza testing, as he said. Commercial. A comparable concern was brought up by Menon from Fortis Medical Clinic. She recommended that fever needs appropriate assessment. We are seeing self-medicine and underplaying the side effects are bringing about patients arriving in a difficult condition to the clinic. It additionally brings about more spread and loss of significant time for right conclusion and proper treatment. Instances of influenza higher this year. Specialists accept that this year, there are a greater number of instances of influenza-like sickness than in the beyond couple of years. We have seen patients with serious influenza-like diseases. As far as I can tell, influenza has resurged following 12 to 13 years as cases are significantly more than expected, Arya said, adding, prior, influenza cases would begin enlisting and topping in the period of November and afterward February. However, this year, cases began coming in June and went on in July and August. While a greater part of individuals will recover, he expressed, those with existing medical issue will be in danger of creating serious sickness. Arya recommends that those with a background marked by diseases should have influenza chances immunization against 4 seasonal infections including flu A, C, and pig influenza. It diminishes the possibilities of ailment and illness by 66 to 70%. Individuals with comorbid conditions like hypertension, malignant growth, asthma, ongoing respiratory obstructive illness, and blood problems among others ought to think about taking the hit, he said. How to separate between continuous diseases. Menon made sense of that irritated throat, runny nose, hack, and windedness show a respiratory disease, though eye torment, higher fever, rashes, queasiness, and unpleasant mouth favor dengue-like contaminations of patients who are accompanying stodgy nose, cold alongside hack and sputum ought to be checked for pig influenza, Manchanda from Medanta said. Coronavirus is likewise tried on the off chance that hack and windedness are noticeable, she added. In the event that patients have gentle side effects, they are overseen on an OPD premise and requested to segregate themselves. In the event that shortness of breath and extreme hack with high fever are available or their oxygen immersion is low, they need affirmation alongside intravenous anti-infection agents, oxygen and, whenever required, respiratory help by BiPAP or ventilator, she said. Antiviral medications are additionally regulated for pig influenza.